You are watching KSAT News at 9, and tonight we're starting something new, coronavirus Q&A. With news surrounding the coronavirus pandemic changing every day, multiple times a day, there have been a lot of questions, especially from you, our viewers, and we like that. On the news at 6, we spoke with Dr. Ruth Bergeron, the Director of Medical Humanities and Ethics at UT Health San Antonio. She is a disaster preparedness expert and an infectious disease doctor. After our conversation at 6, we asked you, our viewers, to submit some questions you would like answered. So Dr. Bergeron joins us now via Skype. Dr. Bergeron, can you hear me?
I can. Hello.
Okay. How are you? Okay, I want to, before we get to some of the great questions from our viewers, first question I have for you is about testing. Are you comfortable with the amount of testing we've seen so far in the state of Texas and in the city of San Antonio?
So until recently, I would have said no, but in the last couple of days, things have really changed, and we have more tests available. Several commercial labs are offering testing. Doctors have gotten information about how to access those tests, and the city of San Antonio with Metro Health is setting up testing sites that are currently just for healthcare workers, but eventually will be used for people who are not healthcare workers. So there's a lot of progress being made in that area, Steve, and that's good news.
All right, let's get to the questions from our viewers. A lot of people are wondering, and it's something we asked you about at 6 o'clock, is COVID-19 airborne?
Right, so we have, up until now, always been calling this something that was transmitted by respiratory droplets. What does that mean? Where the virus is going to go from person A to person B by jumping out of their respiratory secretions. When they cough, it doesn't literally jump, but the person coughs, the person sneezes, and so a little bit of the respiratory secretions go out into the air, and then those little droplets can land on a surface or on someone else's face or nose or get inhaled, and it's transmitted. Airborne, it technically refers to something that's very similar. It includes respiratory droplets, but when you say a virus is airborne, like measles virus, for instance, this means that the virus can survive in the air, very tinier particles that are dry, for hours and hours. And so, for instance, with measles virus, there have been instances in which a person walked through an airport and then other people who weren't near that person but who walked through the airport also got measles. We have not documented this with COVID-19, but it's somewhat concerning that this week some researchers have posted online results of a non-peer-reviewed study suggesting that the virus could last for up to 3 hours in the air. So the WHO is considering calling this an airborne virus, and that is online, and you can read about it. What it means for us is not a whole lot different than what we were already doing with our respiratory precautions, but we need to take all of the instructions we've been getting about social distancing extremely seriously.
Yeah, that's just one of the many reasons why. The next question is, I have an elective surgery scheduled. I have an underlying medical condition. Should I reschedule it?
So I would say no. Our hospitals are up and running and they're offering their elective surgeries. And frankly, I think if you have surgery scheduled this week or imminently, go ahead and get it done now. If you wait too much longer, it may be a very long time before you can get that elective surgery done. If the hospitals become filled with people who are really ill, which right now they are not, but if that were to happen, it would be weeks from now, and you could be looking at a much longer delay on your elective surgery. So I have counseled patients as recently as this afternoon to go ahead and get an elective procedure done now while they still can.
Great. All right. Lydia called in after our 6 o'clock conversation. She said when someone is tested for coronavirus, a courier picks up the specimen to take to a testing lab. Since this disease is so contagious, what guidelines must those couriers follow, and are they different from other pickups?
So I actually had the privilege of observing the SAQ operation this weekend, and I watched how those specimens are being collected. They're being meticulously handled by people who have gloves on. They're constantly sanitizing their gloves. The specimens are double bagged, and each bag is sanitized. So you put the tube with the specimen into one bag, you wipe it down with alcohol wipes, and then you put it in a second bag, and that one gets wiped down. So the precautions are extraordinary, and the method of transmission is not primarily off of surfaces. So there really shouldn't be any additional recommendations or precautions for couriers in this instance.
The next question we have has to do with surfaces. One of our viewers wants to know, how long does the coronavirus, the COVID-19 we're talking about, live on surfaces? I mean, there are a lot of unknowns that go along with this whole thing, but what's the latest thinking on how long these live on surfaces?
So the latest reports are that if it's copper or steel, it's consistently around 2 hours. If it's another kind of surface, such as cardboard or plastic, it could be longer, and it's less clear how long it might last on those other surfaces.
Patricia wants to know, can the coronavirus already be dormant in our bodies and later come out and give us symptoms?
So from the time you first get exposed to a person who has coronavirus, COVID-19, it's going to take 2 to 4 days and possibly as many as 14 days before you have symptoms. So that means that, yes, the virus can be there before you're aware that it's there, and it's possible but not highly likely that you could transmit it to others during that time where you're asymptomatic.
Okay. Since one of the last viewer question we have tonight, since one of the symptoms of coronavirus is a cough, in addition to taking Tylenol for fever, can I take Mucinex for the cough and congestion?
Right. There's no problem with taking medications to mitigate cough for coronavirus. In fact, what we can offer now is symptomatic management. And we want people to stay home and manage their symptoms in accordance with their doctor's guidance and only seek medical attention outside of their homes or beyond their primary care doctor if there is true shortness of breath, difficulty breathing. But you can take a cough suppressant if you have a cough.
Question I have for you, Dr. Bergeron, is are we doing enough in San Antonio and South Texas to combat this coronavirus?
So I would say I'm pleased and proud of the response that I've seen with San Antonio at governmental levels and with the emergency response team. I know that these measures of closing down schools and telling people to stay home and not go out, I know they seem rather extreme, but this is exactly what we need to be doing during this time if we want to save lives. Our goal is to decrease the number of people that show up in the hospital all at once very sick. We don't want to have a situation like Italy where the hospitals were just simply overwhelmed. And if we keep following these guidelines, I really believe that we can slow down the spread of the virus. Doesn't mean there won't be virus transmission. We will have cases. We're seeing more cases every day. But our goal is to keep the number as low as we can and not have a huge surge that overwhelms our healthcare system.
I want to leave with this one thing that you brought up at 6 o'clock. You were in a HIV ward during Hurricane Katrina. You stayed with a lot of those patients there, some of them as long as 6 days until you were evacuated. What did you learn from that situation that kind of translates into the situation that we're at right now?
Well, I learned that the way that we treat one another in a crisis is really important. And although you might not realize it, it is saving lives. So we may not be able to control what's happening to us, but we can control how we treat one another. And I would ask San Antonians to really focus on this. Be kind. What does being kind mean? It includes not going out and being part of a crowd. That's kind because by preventing yourself from getting infected, you're also preventing at least 2 or 3 others from getting infected, and you're probably saving a life by doing so. You can be kind by finding out who are your elderly neighbors that are shut-ins, that are having trouble getting their groceries. We know that the stores are sometimes getting picked clean of supplies right now. Imagine you're 80 or 90 years old, you don't have a lot of help, maybe you don't get out very often. We need to find out who those people are in our communities, and we need to help them. That will save lives. So kindness, can save lives.
I love that message. Dr. Ruth Bergeron from UT Health San Antonio, thank you for joining us. The whole purpose of this thing is to fight fear with facts. Coronavirus Q&A, we hope to bring it to you every night on the KSAT News at 9.